All right, good evening, everyone. Thank you for joining us this evening for our presentation on Futuro Health. During the presentation, if you have any questions, please place your questions where it says Q&A. We'll be monitoring your questions throughout the presentation. And then at the end of the presentation, we'll also have time for questions and answers. You're also welcome to put any other comments in the chat. Thank you again for joining us this evening. My name is Leticia Preciado, and I'm the Parent Engagement Coordinator here at Pittsburgh Unified School District. Joining me this evening is Miss Lucy Boc-Angel, to be doing this evening's presentation on Futuro Health. Welcome, Lucy.
Thank you so much. I also have joining me is Miss Priscilla. And so like Leticia said, my name is Lucy, and I work for Kaiser in Walnut Creek. I am a surgical tech, and I work in the operating room. And we are part of the union called SEIU UHW. And part of that union, we bargained our contract last year. And part of our bargaining, we had a lot of short staffing issues along with that. And so we figured, how do we complete these, or how do we fulfill our short staffing, right? We need more job openings. Now, with these job openings, they also come with requirements. So how do we get these requirements? So Kaiser has agreed to put money into a program that is tuition free to have our friends and families go back to school. And this is for members who do not work at Kaiser currently. So this is more for our community, our families, and bringing them in and giving them some sort of education, whether it's for your child, whether it's for yourself. These programs are, like I've stated, are tuition free. I'm actually going to start my slide real quick. Can you see that, Leticia? Is it showing?
Yes, it's showing perfect.
Okay. So it's called, our program that we have is called Futuro Health. And so we bargained for it, like I mentioned, and these are for a lot of programs that are tuition free. Later on, I will go through a whole slide and where it'll say what portions need to be paid for. So here we are. So this is pretty much, like I mentioned before, our short staffing was such a crisis in the healthcare. So, when the nation was experiencing continuous declines in higher education enrollments, Futuro Health was a successful, drew diverse adults into the allied health credentials to grow the workforce for different categories like medical assistant, pharmacy tech, sterile processing technician, phlebotomist, patient care representative, Medi-Cal peer support specialists, community health workers with behavioral health emphasis, health IT specialists, and more. Addressing the workforce shortages for employers in the public and private sectors. We're trying to get partnered up with different colleges, communities, just to really put it out there. Like I said, Kaiser has given us so much money to put these programs in place. And we're really want to reach out to our communities to get these covered. And so let's go. So improving learning outcomes and opportunities for diverse adults. According to data from approved education partners with whom we collaborate, 83% of the Futuro Health scholars enrolled in their programs of study completed their in-class training, often surpassing normal course completion rates thanks Futuro Health's best practice to bolster learner success. Here is a breakdown pretty much of what we have. Of our 90% of Futuro Health program participants are multiculturally diverse, 52% are bilingual, 81% female, with an average of age of 29. We also offer, as a Futuro Health, once you apply, it's called Human Touch Healthcare. You get one-on-one with counselors and the human touch, where it helps you how to navigate. COVID did such a decline with schooling when everything went online. And I know we see it in a lot of our teams that it's really hard to really get out there and go back to school, or having anxiety or a lot of pressure. So here is a human touch healthcare that helps you with the outside world, with emotional intelligence, empathy, compassion, how to communicate, cultural competence, how to build teamwork, ethics, and integrity. So pretty much here is our main flyer that we have. It's, like I've mentioned, it is tuition free. There's a couple programs that are listed on this page, and there is minimum requirements for these programs. So one of them is, obviously, I told you that we are from the SEIU union, so we are members we are Kaiser employees, and so this is for friends and families who don't work at Kaiser. So you would need a member like myself to be able to apply. So it's a referral. So you would need a Kaiser union member to refer you. So that's the referral that you get. And I myself, and I will put in the chat later my information. You need to be 18 years of age or older, and able to work in the United States with the residents of California. I did have questions come across in a different webinar, and they do accept DACA students. You need to have a high school diploma or a GED. So it doesn't matter if you went to an adults program. High school diploma must be one of the requirements. They do accept diplomas if you graduated from a different country. If you come from a different country and you bring your diploma, that is accepted. You need to have your basic computer, internet access at home. Because these courses are online. Some of these courses are hybrid, where you do online and you come in person for clinicals. You need to be willing to commit 3 to 5 hours per day. So it's about 20 hours, just like regular schooling when you go to regular schooling. As I mentioned before, you do have to complete the Human Touch Jumpstart. It's a prerequisite. It's a course. You have to pass a drug test, and these are the requirements. The only payments that you would have outside would be your tuition enrollment, which is $150, your background check, which is a $77 fee. And obviously you need to clear the background check and clear a drug screen as well. You have to have updated immunizations. That is just a requirement for all hospitals, wherever clinical you go to. And then, of course, full transportation to and from when you go to your clinicals. It is an English-based program, so it's not a bilingual program, so you have to be able to understand, speak, read, write in English. Here is a couple programs that I'm going to be listing that we are offering right now. Medical assistant. They act as an extra set of hands for the doctors and nurses, and they're important to the overall patient experience. They perform both clinical and administrative duties while getting an overview of the many different roles within the medical field. This is an 8 to 12 month program that is hybrid. So partially will be online and partially will be in person. So a lot of these programs, we have felt so strongly about reaching out to our communities, and I was very appreciative for Leticia to reach out from the Pittsburgh School Unified District. I know some of you parents may be having your child's graduating this year, or maybe graduating next year, but these are great stepping stones, especially if they don't know what they want to do. A lot of kids, everything is online. Some don't want to go back to school. Some don't want to go to college. Some aren't meant for college to go to college. Sometimes the schooling is just a little bit different. So right now, these tech schools, you're hearing it everywhere. They make great money, great stepping stone. It's something to get into a medical field, especially if they don't know what it is that they want to do, and they just know that maybe they want to be in the medical field. It's a great stepping stone. And maybe they can decide later, maybe I want to be a nurse, maybe I want to be a doctor, maybe I want to be a radiologist. It's a great stepping stone for them to get in. Like I said, this is tuition free, which you don't get anywhere. The programs like medical assistant can run you anywhere from $30,000. The last time I had checked, it was anywhere from like 24 to 30 grand for these programs. And so we want to help out our communities because it's really hard with inflation and the interest rates to try to even get a school loan to send back your kids to school is really, really difficult. So here's the same requirements, which is going to be for all these programs. The other program we have is a pharmacy tech. You'll see a lot of pharmacy techs. They work under the direct supervision of a pharmacist, and they do basic repetitive activities to prepare prescriptions, medicines for patients, such as counting the pills, they putting the medicines in the containers, labeling and packing. They do the pharmacist checks and doctor's prescriptions for errors, potential problems. So they're kind of more of the assistants of the pharmacist. Phlebotomy. These are the people who go and take your blood when you go into the lab. So these are, this one's what does it say? This program is 2 to 6 months program. So all these programs have different variations of how long they are. They all include a unpaid externship, just like any program that you go to. We have something called a patient care technician. We have these a lot in our hospitals. These are people who actually transport our patients, and they also are part of the healthcare team who administer daily care. Under the directions of the nurses and this nursing team, they assist with taking vital signs, assisting with activities of daily living, assisting in ambulating, turning, and repositioning patients and other tasks. These are jobs that when you go to apply, they have some prerequisites. So in order for the requirements and qualifications to even get into a job like this, they ask you if you've worked in any type of setting. Do you have medical terminology? Have you been a medical assistant? So these programs are actually going to help with the qualifications to be able to get into the hospital field. Another one is a emergency room tech. This is a 16 to 29 week program. It is a 3-part program. It's a bundle of 3 portions where they get a emergency room tech gets an EKG technician certificate. They also get their phlebotomy certificate, and they also get their EMT state certificate with this program. And then here's just the overview in Spanish. Let's see. And I don't know, Priscilla, did I miss anything?
I don't think so. You did a good job. There was a couple comments in the chat, so I tried to answer them. You guys, if there's something I didn't answer, just maybe comment again.
Perfect.
Yeah, there was a question about if the COVID-19 shot is needed. It is. So you need, yes.
Just like, yeah, and that's mostly all hospitals. And also, I wanted to mention that just like any schooling that you go to, a job at Kaiser is not guaranteed. And I know these are schoolings that are paid from Kaiser, but it's not a guarantee that you get a job. But we're working with Allied Up. It's a job placement program. So they help you with your resume, they help you with applying. So they do have a program to help with job placement. But like I said, I don't want the interpretation that because it's a Kaiser program, you're automatically in Kaiser or will get a job, because sometimes that's been the misconstruction of what that is. So just like any schooling, you don't automatically have a job, but you are in a hire since Kaiser is a union based. So what they do, what's the upside of it is that once you apply from the outside, if you're an external application, then they do try to take the students that are from the Futuro Health. Let's see. So I'm going to put my information in the chat. That way, for whoever maybe questions may come up later. Let's see. And if you have someone who's interested in applying, I can definitely help direct them and help them with actually getting onto the application. So the first application portion is once you start to apply. Like I mentioned before, you need to have the SEIU member refer. And what they do is just sign up for an info session Zoom, where it's kind of like this webinar that I gave. It will go over all the information, all the requirements, all over again. So I just posted my phone number. You guys can text me. If you do call, please leave a message if I don't pick up.
So Lucy, I see in the chat that someone's saying they can't see the information that you're placing there.
Okay, thank you, Miss Linda. This is also Linda Hunter. She is also a Kaiser employee and works for the union along with us. Is it able to see now? I just posted it. And so I seen somebody in the chat saying that, asking if it doesn't have to be only for a graduate. No, this could be for anybody who is at least 18 years old. This could be for you parents. This could be for anybody that meets these requirements. But the requirement is at least minimum of 18 years of age. So if you have your 20-year-old niece, daughter, sister, this is for anybody and everybody. If you're interested in applying, I see someone put, how can I apply? Go ahead and give me a text and I can send you the link to get started. Let's see. This will give you your externship is in clinicals. So yes, it can give you that hospital setting experience. But for a requirement, a lot of jobs when you go to, sometimes they ask you for like 2 years experience. And it doesn't mean you need to just apply at Kaiser. These schoolings, if you apply at other hospitals, these are state certificates that you do receive. So this is not just for a Kaiser job. This is actually a state certificate that you do receive. So we don't have the billing and coding just yet. Miss Linda or Priscilla, was that something that they took off or we haven't had it yet? I can't remember.
Yeah, so it was available at one point. One thing I want you guys to know too, I don't know, Lucy, if you touched on this, but what Futuro does is they actually look for the vacancies within our like facilities at Kaiser Permanente. So where we're short staffed is where they're creating programs. So right now we might not have a need for coding, but if more positions become available, they might create, another opportunity. So definitely when you see those come up on Futuro Health, apply to them because they are limited and sometimes they go away and they bring new programs in so that we can try to get, all of our positions filled at Kaiser.
So to add to that, this is Lady Linda. So to add to that, what Priscilla was already speaking and what Lucy has covered quite a bit. We also would like to make sure that everyone, if you're not of age at this time, or you're thinking about maybe I'll look at this a little later or something of that nature, feel free to do so, but do know that the courses change as to according to what the Kaiser is asking us to help with specific classifications as to the number of positions that may need to be filled. Right now, one of the top positions is the medical assistant position, as to which they're asking for the most applicants to be in place. But upon completion and in good standing of any of these courses, and you're on the outside of Kaiser, you will be one of the applicants that are more likely to be chosen, because Kaiser has come together with us for this school. So our Futuro students are going to be chosen before our other outside applicants. So you need to know that as well. And it's not for just for Kaiser employees. This is for families, friends, neighbors, someone you meet in the store, anyone of that nature. We're trying to bring people into the medical industry for patient care. And we're very short in every position that you see. That's it. Someone was asking about the PCT position, the length of time. It all depends on which course you take. To get the best information would be if you log into the link that was placed in the chat by Priscilla. So you can go into the orientation, which costs you nothing, to actually see and hear and have every question answered that you could probably ask. That would be the best thing for you to do.
Thank you, Miss Linda. I'm going to put my information in the chat. I tried to send the link, but I don't know if it came out as a link. I think Priscilla, they sent the link in. I'm going to put my information. If Miss Linda can put her information, you can use either information to go ahead as a referral. What you do need is our full name, our phone number, and I believe there is a 4-digit code that you need that I will put in the link, and then Miss Linda, you could use either or. Would work.
I believe there's a couple of questions as well, as far as when the programs start and where the clinicals hours will take place.
So for when it starts, once you apply, it will give you your in-session Zoom call first. And then once you decide that this is your requirement, they will set you up with an orientation and a one-on-one with a counselor. And then they will go over, because it depends on where you live, on what area or how you will begin. They will give you that information at that time. What was the other part of the question? What was the other part of the question? I'm sorry.
Where is the school located for these programs?
So it's all online. The schooling, the didactic part of the education is online. Where you go for your clinicals is you will go over your counselor, because it really just depends on where you're at and where do you live and what hospital is taking for clinicals at that time.
There's also a question if you have an office where they can go for more information.
You could reach out to myself. I had put my phone number in the chat, and then I can direct you from there.
There's also a question as to the programs that have unpaid internships, how long those are.
Say that again, the unpaid.
For the programs that require an unpaid internship, how long those unpaid internships are.
Each program has a minimum requirement of hours for internship, and all internships are unpaid. So it really, really depends. Some are 80 hours, some are 300 hours. So it really depends on the program that you choose. And those are great questions. So when you go to the orientation with the counselor, so it really depends on the program you pick.
All right, and then there's a question if the classes are in the evening or daytime, or if there's a variety.
I believe they're during the day online. Correct me if I'm wrong, Miss Linda or Priscilla. I believe that they are in the day, but I can get that information. And I'm trying to get the actual link to, I'm going to add it into our chat.
The other question is, what are some things that we would need to pay for as far as for the medical assistant program?
Great question. So as I mentioned before, it is a $150 enrollment fee, your background check. And because this is a union program through Kaiser, then you become part of the union, which there's a monthly cost of $20 a month that they will take out. The rest of the tuition is free.
Thank you.
Here is the link. I know a couple people, I'll get back to the people who have texted me with the same link, but the link I just put in the chat to make it a little bit easier. And once again, you need the referral information.
And then Lucy, for timing, I was just looking at the flyer and it says that they would actually go over this information with their coach. Yeah, their counselor. Yeah. So they set that up and they try to make it work for the student.
And so I wanted to also kind of go over so once you get the informational from the Zoom, you'll get more information on there as well. I believe they're about Tuesdays and Wednesday evenings, like at 6. They have them frequently weekly, so it's something once you apply and get onto the link, then you can go ahead and apply for your info session. And along with that, it's a one-time lifetime class. So you have to be able to be committed to what program you want to take, because you can't just enroll, you can't cancel your program and then enroll to another one once you have been accepted into the program. So it's great to ask all these questions, to have these ready for when you go to your orientation and get with your counselor before you're completely admitted. Because if it's something that maybe you're in between 2 courses and you have no idea, it is a one time and you can only apply for the program once, since it is a tuition-free program. So the referral information, once you hit the link, you will put the information for the referral, which is my name, my phone number, and because you need to have, like I mentioned before, somebody from a member into the program. And then Miss Linda, if you would like to put your information as well, that way you can use either referral.
I will add my information to the chat.
Thank you, Miss Linda.
There is a question, if somebody is already studying to be a phlebotomist, but they want to study something else, can they join?
Yeah, I mean, if they study somewhere else and it hasn't been through the Futuro Health, yes, absolutely. If you choose that you wanted to be a medical assistant, if you choose that you want to maybe be emergency room tech, then absolutely.
I think there's a comment in the chat that somebody does the $20 for the union. Is that once they have joined?
Been completely accepted. So it does not start now. It starts after you have been accepted. They do not. I see a comment. I turned 18 on June 26th. How happy birthday, because that is my birthday too. It's a great day. So yes, as long as you're 18 by the time you start in your courses and you have graduated from high school and have your diploma and meet all the other requirements, you just need to be 18 years old once you start your courses. So I'm not sure. I hope the person who had asked if you can apply to more than one, you can only apply to one, unfortunately. it's a one program since it's a tuition free. So those of you, if you were in the program and you feel that no one has reached out, text me with that information. That way I can give you the person or the email that you're supposed to contact. The $20 is a monthly while you're in school. You are part of the union and it's a monthly, it's not a one-time cost. As long as the courses have not been filled, it should be a 100% acceptance rate as long as you meet the requirements, yes. But it also depends on the courses filling up. You can use Linda Hunter or myself, Lucia Bocangels, as a referral. You just have 2 people to choose from. It really does. Both of it works. It does not matter. You can choose either or. So since it's a tuition free, you would not need the FAFSA for. Someone asked if they can apply to FAFSA when taking the courses. You don't need the FAFSA because it's tuition free through the program. There is no fees. Yeah. As someone asked, is there a deadline? There is no deadline, as long as the courses are open. And like I said, I think it'd be a great idea to go to the info session, at least Zoom, and get a lot of these questions, because these are the people actually that are going to be working with you, and with the programs. When you first, so someone mentioned that they went onto the link and they couldn't be processed. If you first open up that link, you need to put the referral member first. So it'll be Linda Hunter or myself. You choose one and put that information in first. Once you add that information of our referral, then it will click you to the next page, and that's when your information will go in. So make sure at the first opening, it is the referral information.
All right, I don't see any additional questions. I want to thank Priscilla, Lucy, and Linda for this evening's presentation. And Ms. Priscilla, did you put the link on there where they can sign up?
I think I did. Yes,
Yeah,
I think I did. I can re-put it. Because I know this link the chat gets, let's see. And I will re-put it on here.
There's a question asking if someone has done Cal Grows training, if that counts.
I'm not sure what CalGrow's training course is. If you can elaborate.
Somebody's saying that, do they have to put a debit card now?
It does give you that option to put it in now. You do not get anything taken out. The section says who will be attending. So there's a question that says who will be attending this orientation. You put the family friend, because as an SEIU member, we do not take these courses. So you put that the person attending is the family or friend of a SEIU member. you guys would not be the SEIU members. You guys are the family or friends. It does ask you for a portion to put your credit card. They should not be taking anything out until you are completely accepted.
All right, I want to thank all of you for attending this evening and thank Ms. Priscilla, Lucy, and Ms. Linda for this evening's presentation. Again, if you are interested in attending or considering applying, please go ahead and sign up for informational session. Ms. Priscilla put that information in the chat. Place it in there again.
And for those that saying that they're having a lot of trouble, it wouldn't validate, I can help you offline.
Thank you, Ms. Priscilla. All right, so I want to thank each of you for attending this evening and thank all of you who are PUSD parents and family and scholars for attending. We'll be sending the recording of this presentation via Parent Square. Please feel free to share the recording and along with the information with other members of our community who may be interested in applying.
Thank you so much, you guys. Thank you, everybody, for attending and your time. Thank you, Leticia, for having us. I'm very excited to get this moving forward.
Thank you, Priscilla. Thank you, everyone.